Thank you, Mr. Speaker. Well, Mr. Speaker, we all know that the Health Minister is actually quite the dancer. But last week he tried his luck at being a stand-up comedian. In explaining why the government continues to refuse a public inquiry, he recited the Alberta Evidence Act word for word. Apparently this was very funny, as all his colleagues behind him were hooting and hollering with laughter. To the Premier, do you still think ignoring the need for this public inquiry into physicians' intimidation is funny now that the Alberta Medical Association has called for it?
The Honourable Premier.
Mr. Speaker, as I said before, the Health Quality Council is in the process of opening up the review. This review will be very intense, following its own terms of reference. They will bring people forward that they feel that should be making and delivering evidence before the Health Quality Council. They are going to do a good job. They have good legal advice, and according to what I've heard from physicians, they're willing to just want to get this on, and so that this matter can be settled once and for all.
The Honourable Leader.
Thank you, Mr. Speaker. Again to the Premier. Given that Friday's letter from the AMA was an unprecedented show of courage from Alberta doctors, whose only concern is the well-being of their patient, does he not realizing that by refusing this public inquiry, he is trivializing the concerns of Alberta doctors and their patients?
The Honourable Minister.
Thank you.
Not the Premier.
Mr. Speaker, in fact, what the letter of last Friday also indicated was that the AMA is willing to participate and willing to cooperate in Part 3, which deals with physician advocacy and allegations of intimidation. And they also stated in that letter that they have already submitted very good suggestions on how to improve the review process. So clearly, the AMA understands both sides of this coin, and I think they're working hard to show that with good faith and good leadership.
The Honourable Member.
Mr. Minister, they want both. They want the Health Quality Council and they want a public inquiry. Given that under this Premier's watch, public confidence in the healthcare system has eroded, will he finally call this public inquiry so we can start to undo so much of the damage that his government is responsible for in this current healthcare system?
The Honourable Minister.
Mr. Speaker, let me just read you the clip here because clearly they're not getting it over there. It's dated April 15th, 2011. It's the President's letter from the AMA, which I will table shortly, and here's what they say on page 2. If, however, and I quote, the HQCA review remains the only formal venue where physician intimidation is examined, then the AMA will cooperate. We have offered suggestions to improve the effectiveness of the review. For example, remove barriers posed by non-disclosure clauses, release physicians from any contractual obligations or provisions under agreements that could silence or deter them from